How has COVID changed everything at the apartments?
It has really changed our operating procedures quite a bit, where we had 2 volunteers in the office at all times. Now we just have 1. We've had to close the community room, which has been used in many instances for events. We have dinners provided by different churches, Sunday school classes. And one of the most important events we've had, which our guests just absolutely love, is bingo nights. Judy and Harry are in charge and have been in charge of bingo for how long?
A long time.
Decades. And that's the most popular event we have, other than the meals. We've had to curtail the visitation of our guests. Just a number of things to keep the separation. And 80% of our guests are MD Anderson patients, so they're already very conscious of wearing masks. That mask has been very prevalent around the apartments since we first started.
One of the things also I learned the other day, we're extending the stays for people who now during COVID, right?
We've been able to do that. The other thing that seems, I'm not sure exactly this is by design, but it doesn't seem as though as many of our guests are having to stay at MD Anderson as long as they usually do. And there just seems to be a much larger turnover of people. Now we do have a waiting list that still has about 250 names on it at all times, but the turnover of the apartments have been much higher than in my previous experience.
Okay. I'm sure MD Anderson wants to get them out too, so
I think that's
staying in a facility.
and they want to get out and get back to